I think that hematology is definitely living its revolution in the last 10 years, and we know that in myelodysplastic syndrome in Croatia, 5-azacitidine as a drug appeared in 2013, and I know that every year when we gather in MDS group, we discuss that when we will find more new drugs or more combinations to achieve better overall survival and progression-free survival for these group of patients. I hope that this kind of meeting will provide us with more therapeutic options, that we will have more insights and knowledge about hematopoietic niche and epigenetic mechanisms that we could use in the future for better therapy options. We did have some pretty strict criteria in the last few years, but definitely due to many insights into molecular and pathogenesis of MDS, this MDS as heterogeneous disease is changing, and we have new material every year, and that probably should be implemented in our new guidelines and in our new prognostic scores. As MDS is pretty dynamic disease, I think that IPSS and our IPSS that we use at this time point is not maybe good enough to predict the level of progression for some kind of patients, because it put a diagnosis or score at the time when we diagnose the patients and not much with following up. So I hope that these small molecules that we are investigating day by day will help to get a better profiling of these intermediate to high-risk patients. I'm not that much worried about these patients that are considered to be low or very low according to the score that we have, but these intermediate or more aggressive forms of MDS are definitely something that we should look for and probably have more precise molecular markers or some kind of non-invasive blood markers that we predict who will progress to AML. Well, definitely, I think that for the group of patients, the role of allogeneic stem cell transplant, not just for younger patients, but also if the patient is fit enough and he's older, I guess that in case of stabilizing him or lowering the blast counts below 5% or whatever the team decides to do, that we should offer allogeneic stem cell to more patients that we did until today. And I guess that epigenetic mechanisms that we will discover will definitely help us to have more, I believe, epigenetic or even targeted drugs that we use today in other hematologic malignancies like CLL or multiple myeloma.